S series has two advanced scoring systems. One is Early Warning Score EWS and the second is Glasgow Coma Scale GCS. In Early Warning Score, it helps you to determine the illness of the patient and proper intervention at the exact time. And in Early Warning Score, we have two types. One is National Early Warning Score and second is Modified Early Warning Score. And in Glasgow Coma Scale, it helps you to measure the exact consciousness of a patient, especially after brain injury. Thanks to our remote viewing capability, we can also check the vital signs of the patient in bed 8 along with the current patient. This allows us to monitor multiple patients without having to move from one bed to another. S12 comes with 5 standard parameters and it can also be upgraded with dual IBP, ETCO2 and cardiac output. In S series, we have gesture support where we can swipe between the displays using just 2 fingers. We can also increase and decrease the brightness just by swiping up and down. Same for volume, we can increase and decrease by swiping up and down. In all our monitors, we have 5 calculations: drug calculation, hemodynamic calculation, nephridium calculation, ventilation calculation, and oxygenation calculation. In ECG screen, we can simultaneously view 12 leads. We also have signal quality index to understand the quality of ECG signal and premature ventricular contraction counts. We also have 27 arrhythmia detections, an ST view, an ST graphic view. In SpO2, you can also see the perfusion index and the pulse rate. For respiratory rate, we can select different sources as CO2, ECG and even SpO2. S series is the first monitor to integrate the drip monitor module, which can monitor infusion rate, stop infusions and sound alarm. In S series, we have a detailed review. Once we press the review button, it gives you all the detailed events. If you would want to go to a specific event, you can just tap on it and press detail. Here you can see at that moment how was the ECG, how was the SpO2 and how was the respiratory. And you can go forward and backward, and if you want to take a printout or if you want to record further, you can still do the same. In S series, we have multiple quick keys. The first one here is alarm reset, which will reset all the parameter alarms to the default values. We have alarm pause. So once you do an alarm pause, it does a pause for 2 minutes. Then we have review option. In review, you can go for trend table, which will give you a detailed value of all parameters as per your specified time frequency. We also have trend graph, which will show you the graphical values along the parameters. We have event button, which will give you a quick view, or you can also select a detailed view. We have full disclosure, which will give you up to 3 days, that is 72 hours of full disclosure available with us. And the next review is Oxy CRG, and the additional is for drip monitoring. These are the review available with us in the review option. In screen setup, we have normal screen, big font, ECG screen, dynamic trend, remote view, Oxy CRG and EWS screen. And the layout can be completely customized. As per the doctor's requirement, you can customize the color, customize the location and even the individual quick buttons here. And the quick keys, you can organize them as per the clinician's requirement. Parameter switch will enable you to enable or disable specific parameters, which can be enabled or disabled using parameter switch. Parameter color. Here you can select the colors which optionally can be selected for all the parameters here and specific to the major parameters in here. These are for screen lock duration, brightness adjustment and on battery the brightness values. In alarm setup, we have all the parameters alarms in one single page and there are no complications of 2 or 3 pages All the alarms are available in single page, including the basic parameters and the ST values and the arrhythmia analysis, and for the setup of all the alarm values in total. Patient management. Here you can select the patient type as adult, pediatric or neonatal, the age, height, weight, gender and other details. These should be very useful when you connect the patient monitor to the central monitoring system. NABP start stop. This is a manual key for NABP start stop and the next set of quick keys. Here we have NABP measure, which has an option for manual, sequential and timed mode of NABP measurement. We have NABP stop all, which stops all the NABP which is happening currently, and NABP stat mode, which is especially used for shock patients where for 5 minutes it takes continuous BP readings. We have zeroing calibration. We have a real-time record where you can take a printout, and freeze option to freeze the waveforms, and you can record them and take a printout, and a standby. This S series can be connected to a central monitoring system where you can monitor up to 64 patient monitors at a single time. In S series, we have two models, S12 a 12-inch monitor and S10 a 10-inch monitor. Trust above all, equip your hospital with BioLite patient monitors. For further details, please contact us.